Olá a todos, bem-vindos ao SBC Podcast. Estamos aqui ao vivo hoje do 19º Congresso Brasileiro de Coluna, último dia de evento, dando sequência à nossa série de entrevistas com os nossos convidados de honra do Congresso, com os nossos convidados internacionais do Congresso. E temos aqui uma das grandes estrelas da nova geração da cirurgia da coluna no mundo, Dr. Han-Jo Kim, da cidade de Nova York, um dos líderes da cirurgia de deformidade vertebral no Hospital for Special Surgery, HSS, um dos maiores hospitais ortopédicos do mundo e referência mundial no tratamento dessas doenças. Han-Jo, além de super generoso, é um grande amigo de muitos anos e vai estar aqui com a gente hoje conversando sobre temas bastante interessantes. Han-Jo, thank you very much for being here. It's a great honor on behalf of the Brazilian Spine Society to have you here again. I know this is probably your fourth or fifth time in Brazil, and every time you came here, you enlighten our brains with your experience and scientific content, and of course your kindness and your friendship is something that we really appreciate. Thank you for coming.
Of course, my pleasure, and it's an honor to be here as always and spend some time with you. And I could say I'm very impressed with the Brazilian spine surgeons. It's been a few years because of the pandemic since I've been here, but to see the progress that you guys have made from the scientific, academic, clinical side has been really inspirational to see. So thanks for having me. I'm really honored to be here. Thank you
very much. Thank you very much. I just mentioned that you are probably one of the rising stars on the young generation of spine surgeons in the world, especially in US. You have a very fast growing in your career, especially coming from well-known trainings in orthopedic and spine surgery, and dedicating yourself to science, to data collection, and to good surgery. And I think you probably would be one of the persons in charge of changing the future for spine surgery. I follow your career for over a decade now, and I want to know from you how to become an important surgeon in that young age, how to become a leadership in such a young age.
Yeah, I mean, I think I've been incredibly fortunate to have tremendous mentors in the field. Even before I started my practice, I remember taking some trips to Ghana, Africa, under the mentorship of Dr. Ohena Babawachi. And when I was at HSS as a resident, he took me to Ghana early. And even before I started my attendingship at HSS, I spent about 3.5 months there in Ghana, doing complex surgeries and, of course, spending a lot of time with a lot of other international spine surgeons who were visiting Ghana at the time and doing complex spine surgery, especially some of the well-known spine surgeons from Spain, for example, like Ferran Pellicer and Paco Grueso. And I think the exposure to all these surgeons, Munish Gupta also was dedicated to the Ghana trip, was very pivotal in my career because I got to see certain things perhaps at a much earlier time than otherwise. Also doing a high volume of complex cases very early on, maybe 30 or 40 three-column osteotomies in the first 6 months of my practice, and has changed the trajectory for me, and of course the mentorship that I've had with Larry Lenke and then Frank Schwab and Todd Albert, and some of the collegiality within the ISSG, which I think has been very important as well, because the collaboration and the discussions about our common complications and how to avoid them, and it's really a diffusion of knowledge every time we meet, which you can't necessarily quantify, but it changes you through time and exposure.
It's interesting because I have done many of these interviews before, and one thing or maybe two things that every single surgeon say here is travel. It would be very important for you. See different surgeons doing surgery, find mentors, and put yourself in a humble position to learn every day.
Yes.
Curiosity and passion. So I think that's
exactly right.
Summarize, yeah, pretty much the whole decision makes that make you outstanding surgeon. I learn with my mentors as well, and I try to see as many surgeons as possible, because I really think this can change the way you pick something from each one and make your own way of doing things. So is this something that happens here all the time? You mentioned about the Ghana project. Can you explain a little bit more? What is the Pode? What is Pode doing in Ghana for many years?
Yeah, so Pode, I think over 20 years ago now, started a hospital there called the Focus Hospital, and it's basically a foundation that's based on orthopedic surgery. It started out with complex spine, but now they're basically doing all orthopedic surgery at that hospital. It's fully funded and running by itself independently now because I think Oheneba, starting a few years ago, has taken a political position of governance within the Ghanaian government. So he has now left the hospital and most of the runnings of the hospital with dedicated staff for the hospital. So I don't think he's necessarily doing surgery anymore, although he does still, I think, consult on cases and attends conferences and stuff. Yeah.
This hospital begins as a non-profit organization, right?
Correct.
Collecting funds from. I heard about some dinners that Dr. Boachi did in the past in New York City, trying to find people to support this type of initiative. How the program manage all the fundraising and what kind of patients they taking care?
Yeah, so I think the fundraising is happening through the foundation. They have annual galas in multiple areas. There's an active board of directors that also advises on fundraising methods and endowment campaigns. As far as the patients they try to reach out to, initially it was mostly in West Africa and that whole area around Sierra Leone, Ghana, and Ivory Coast, but also in Ethiopia as well. And that was through some of the collaborations that he's had with some of the other medical physicians that were available in those areas that saw patients with significant spinal deformities that needed to be treated. So it was like a referral for that reason through multiple avenues and into that hub in Ghana. And
those initiatives is something that you feel like giving back to those patients every time you went there. That probably is a very poor population, severe spinal deformity, and the whole program is a non-profit organization trying to find funds through those initiatives. But for you as a surgeon, I know this is a organization itself is running by itself, but how that affects you as a surgeon?
Well, I think one thing is there's a tremendous amount of gratification you get out of volunteering your time, because if I were to go now, it would be a completely voluntary trip, and actually the way that Dr. Boachi and the hospital has structured the spine surgeries now is there's a subset of patients that are covered by the government within Ghana, but if we as surgeons want to go, there's a particular case that we are sort of in charge of, or a few cases, and we have to be responsible for raising funds for the trip to cover our airfare, to cover the surgical costs for that operation. I think it's roughly around $50,000 now, US dollars, for a fully funded patient, including the entire hospital stay, the implants, the operation, and the airfare. So obviously, when we go as surgeons, we don't get paid anything, but it does allow us to raise funds for the mission of the hospital and the institution.
Okay, interesting. I know you're very busy. I know you have a big clinic, you do surgeries pretty much every day, and you're still very connected to science because you're publishing a lot of papers. You told me at some time before that you have a dedicated day on your schedule just for science. How you manage your time in terms of combining personal life, a very busy practice, and also including meetings and science?
Yeah, I mean, I don't think there's necessarily one solution. It's always an evolving balance. Sometimes one area of your life requires more time than others, and you just spend life juggling all of that. It's the journey that is the fun part. But I definitely read a lot about efficiency models and take into consideration some of the strategies that other leaders in the world have written about in regards to time management. For example, like the 20-10 rule about working working versus break time, and also like how much effort you put into one thing, such as the 80-20 rule and things like this. So I try to compartmentalize things as much as possible, and take frequent breaks, short breaks, even if it's 5 to 7 minutes, but to help avoid fatigue and burnout and things like that. It's been tremendous for me to have an outlet such as exercise, which has been helpful for me to unwind, but also to think, because sometimes you go on long runs, for example, or you're in the gym and your head just wanders, and sometimes you end up at a place. Sometimes you find research ideas on these these runs and trips.
I myself in this position.
So I think in some ways, when you're doing something like that, you're killing two birds with one stone, right? Because you're going for a run, you're exercising, but you're also thinking about the science of what you do. And I think all these things are helpful to try to manage time.
Once I realized that those are very important for your health, of course, and also for your brain, but also having like a hobby or something that drives you to another dimension, so you cannot think about work and your problems, is very, very important to keep your mental status. So.
Yeah, I agree. I mean, burnout is something that a lot of people focus on recently. I think partially related to some of the advances in technology, where you can't really get a break, right? There's no, like, before you used to travel to go to meetings. Now you could do meetings on Zoom. So like you have the meetings in person, but then you also have the Zoom meetings, and it's like
you also have the Zoom meetings.
Yeah,
it's just adding, right?
Exactly. There's never a break. So it's important, I think, to be able to balance some time off, and I think hobbies are great. And obviously at the same time you're doing your health a favor as well.
Yeah, of course. How many days a week or a month you dedicate for science right now?
It's hard to quantify, but at least one day a week I have dedicated towards administrative duties and some research related activities, whether it be reading or thinking about another project, or working on a manuscript, or editing, or advising some of my mentees or junior partners and the research team on projects, things like that. So it's not necessarily one day completely, but what happens is a lot of the times I may have half a day here, and then on the weekend, on Saturday and Sunday, I'll do a little bit to kind of make up that time.
But you save this time in your schedule. So
Yes.
you're planning to do this, because otherwise you're going to be doing surgeries pretty much every day.
Yeah. I mean, you definitely need to protect the time, because it's easy to get lost and to not have that as a protected time. And it's just like everything, like you need to protect time with your family, you need to protect time for yourself. And if you don't do those things, everything starts to blend together, and you start to lose focus.
Learn to say no sometimes.
It's very hard to say no, but yes.
Yes. You're very active scientifically, and I know you have a strong connection with ISSG. A lot of the publications that you did it in the past and is still doing is related to the International Spine Society group. I want to know from you, how is the experience of working with that very distinguished group of minds, very bright person, and how you guys collect data on the database on the daily basis, and how to manage a study group like this, because you guys change probably the history of spine surgery with all the data that you collect in there, the AI analysis, and all the influence that you guys have in the spinal deformity, adult spinal deformity field. So how is to deal with a study group? What is the rule for making that happen, and what is the tips that you will give to future generations?
Yeah, I mean, I think the ISSG has been an instrumental part of my career and development. Like I was mentioning before, there is so much knowledge and experience at all of these ISSG meetings, where there's an interchange of ideas and experiences, and it results in a passive learning. Like, you find yourself in the operating room after a week or two after the meeting doing something different, and you wonder why. It's not because you thought about it yourself. It's because you've been around such great people and with people with so many diverse experiences and have had that complication before, have worried about this before. And through the conversations and the generation of study ideas, you yourself find yourself changing because you're exposed to that. And I think because of that, the ISSG has been really, really tremendous. They've had the fortune of having really dedicated leaders, for example, like Shea Bess, who dedicates a significant amount of time to the ISSG, and also Virginie Lafage, who is instrumental in the data collection. I mean, all of us at our institutions, we have our own research coordinators that send the data to a centralized database and everything like that. But the person that really organizes all of it is sort of centralized with Virginie and her team. And I think the success of the ISSG is probably because of members like that, in addition to those members within the executive committee who have, dedicated a significant amount of time to the organization. And the knowledge exchange can't be replaced. And I would say it's also akin to coming here to Brazil. Mm-hmm. Every time I come here, I learn something different. I think the last time I was here, I had spent some time at your father's symposium, Dr. Pimenta. And it was really interesting because after a few of his talks, I found that I was trying to spare L5S1 on long fusions and preserve 5-1, and even if that meant 5 years of extra motion at L5S1 for a 50-year-old, active woman who has scoliosis, 5 years is worth it. Yeah. Right? So I think it's all an evolution. It's all a great knowledge exchange and collaboration, and we all learn from each other. And as long as you have an open mind, you could get tremendous value from that.
Yeah, you guys managing one of the biggest database in adult spine deformity in the world, and probably over a decade now or more, maybe. Have you guys ever considered to transform this database in an open database process? Because there's a lot of advance in data analysis, and also in developing, especially after COVID, with the open database for partnerships for science. There's a lot of advances putting more eyes on the same data and open the data for science evolution. Have you guys ever considered to transform that database? Of course, respecting anonymization and all the topics, but you ever considered to transform that database in an open science database?
Yeah, I mean, I think some of that has already started with our collaborations with the ESSG, and sometimes some of the alignment models, for example, that were developed through respective databases, we would validate it through the other database. Mm-hmm. So some of the ESSG work with the gap score,
merging populations.
They were trying to utilize the gap score validation under the ISSG PON database, and things going back and forth in regards to some of the predictive modeling. So I think there is an opportunity. I know that the ISSG is very open to collaboration. For example, if somebody from, one of your colleagues here in Brazil had a question.
Yeah, I already sent some of my data to Ames, to Virginie, so I know that, but I'm, putting some pressure on going beyond that. Real open data for open data collection, and also international data collection and analysis. So this would be of great value for the science.
Yeah, I mean, I think as long as it is, I think having it all open is not a bad idea, but there has to be some control in regards to the utilization. Yeah. Because I think the problem is, aside everything that you mentioned, of course, is going to be there, the anonymization, the protection of patient privacy. But if we're talking about data, for example, that have been collected by surgeons through their work and their infrastructure, and to have it free flowing, I think we're very free flowing in regards to ideas and concepts. For example, if there were surgeons that had certain hypotheses in regards to what they wanted to test and validate with the database, I think we would be open to it. But I think there's definitely a process, and there's process exists right now within the ISSG where we could take an idea, we could try to publish something or write an abstract, but it will not pass and actually be submitted for anything until the executive committee of the ISSG has reviewed it.
I would be a little bit more specific because why I asked this question is because I know you guys are working in predicting models and using of artificial intelligence for predicting complications, example. And one of the limitations of artificial intelligence right now is that you have to teach the algorithm how to find the solution. But the only way of teaching algorithms to find a solution on a result is having a very broad and heterogeneous database. So you just mentioned that you, as a member of the ISG, every time you go to a meeting, you become part of the process, part of the group. So you change a little bit the way you're doing things. In a point that in a period of 10 years, you all are doing pretty much the same. So the heterogeneity in your database is probably very small, because you guys molding each other to the way you consider is the best way. So that will be a little bias in my opinion. It's not a true bias. It's just some noise that can create a false result based on one point of view. So
I agree.
Having an open database probably will be a very good solution for mitigate this type of issue.
Yeah, but I think there is still a significant amount of diversity in the way that we tackle pathology. For example, I'm probably one of the only members of the ISSG right now that does all posterior surgery without interbody use. 75% of the time for my deformity operations, primary deformity. I probably do a ton of PSOs, and probably have the most PSOs just because of the way my practice is, and maybe other people might be doing more A-lift surgery, for example. So I think there's still a significant amount of diversity, and that diversity allows us to test each other's hypotheses and models. For example, we recently tried to look at the concept of tethering on junctional kyphosis, and the data was very interesting, and actually it was interesting to note that even though people talk about tethering within the ISSG, and we all kind of say maybe we should try tethering, when it came down to the data, only about 30% of people are tethering all the time. And then there's probably another 20% that tether once in a while. There's people like me who never tether, and or I might tether once every 50 cases or something like that. So I think there is diversity, and the fact that we do travel, each of our respective members, we do travel, we still maintain our academic sort of pursuits outside of the ISSG, maintains some level of heterogeneity and diversity that allows us to test the models. And I think one of the possibilities and potentials for the future is to expand data collection beyond radiographs and demographic data, operative variables, right? I think we should go to things like genomics and behavioral data.
Telomeres.
Yes, exactly. Well, not just telomeres, but also expression of certain genotypes and how that affects patients. For example, even something like, for example, hypercoagulability, right? I talked about that earlier, but if you're hypercoagulable, you're more likely to have some issue within the coagulation cascade. It's a genetic issue, right? So you're more likely to have a risk of a DVT or a PE after surgery. So what do you do to that patient? You give them Lovenox. You try to anticoagulate that patient. And that's a genetic thing. But I think that's sort of very basic genetics, but there's much more complex genetics that we could do now with sequencing technology, that we could say things like, oh, according to the genetics, this patient is probably going to have an ileus with oxycodone, but probably not with morphine derivative. So maybe we should switch the medication, because otherwise, if they get an ileus, they'll stay in the hospital longer, they'll have more issues, more complications. Yeah. So, and that's, of course, related to like dopamine receptors and opioid receptors within the gut. And that's personal. Everybody has their different expression. So I think integrating some of these, this data will be extremely helpful, in addition to behavioral data. Like what time does the patient wake up? What time, how many steps do they take in a day? Cultural differences. Absolutely.
Because, indicate T10 to the pelvis in US is probably different than in Japan.
100%.
It's probably different than in Korea and in Brazil, because we have different population.
Absolutely.
With different activities and different expectations. So
exactly.
Probably this changed the way the patient face the surgery, and probably change the outcomes as well.
Yeah, absolutely. And we have to also be extremely sensitive to like regional stressors that affect data and procedures and techniques, right? Like you and I had a conversation a few days ago about cost pressures in Brazil, and how that's very different from cost pressures in the United States. Well, I could tell you that when I talk to my colleagues across the United States, I'm in New York. Some of my colleagues are across the country, and we talk about different cost pressures, even within the United States, based on the region, Texas, California, and somewhere in the Midwest. And
you can imagine this,
of course,
from US to Canada, for example.
And that's going to affect the care delivery, because, at the end of the day, the the hospitals are keeping an eye on this, and they give you a little bit of pressure about having operations that are very costly, for example. So I think all of that adds to the diversity of data collection that we could utilize, and we could really, I think every time we have meetings like this or we have collaborations of data, the main thing that we could do is really look at everything with an open mind, and then it's sort of cherry picking.
Yeah,
you got to pick what works for you and your system. That's very important.
Yeah. Size is always like this.
Yes.
Awesome. It's been a very thoughtful conversation. How you think is the relationship with societies, especially I'm asking about SRS because I know you're a very active member of the SRS, and we as Brazilian Spine Society, we're very grateful for the partnership between SRS and our society for many years. I know is highly appreciated from us, and I know SRS also enjoying this type of international collaboration and is moving to a more international and having real participants all over the place. How is participating in an international society for you, and how you think this can mold and change the way as a surgeon, this change your decision making and make you a better surgeon every time?
Yeah, I think the SRS meeting and the SRS as a society has been tremendous in my career as far as exposure. For example, I was a SRS traveling fellow, I think in 2017, got a chance to really visit a lot of places in Europe, everywhere from Spain, France, Germany, all the way out to Russia. Really had a tremendous trip and learning experience, and also like just like I said before about the ISSG meeting. Well, if you go to the ISSG meeting, there's 20 deformity surgeons that are meeting and talking about an issue and doing research. When you go to the SRS meeting, there's 1,000.
Yeah.
And I think as far as the worldwide mission of the SRS and the transition to really taking it to a worldwide society has been going on now for over a decade, and that mission is continuing to improve and refine. And I think that element of the society is really important. And the inclusion of all these other countries, I think, is adding to the knowledge exchange, which is important for the care of these patients. So, I think the SRS is a tremendous organization that is doing a tremendous job in regards to worldwide collaboration, and the collaboration with the Brazilian Spine Society and the meeting here, I think, is a necessary step in what the future holds for both societies.
And it's very important for us as well, because you guys, this is exchange of knowledge is very important, of course, for you, but as part of the board of directors of the society, I have to think about the standard of care of spine surgery in my country, and I know you guys collaborate a lot with this evolution. So
Definitely.
Thank you very much.
Absolutely. Absolutely. I mean, I think the initiative with the SRS on worldwide courses, for example, I think has been tremendous as well, having taken them to regions and being sensitive to the areas of need, and it's an ongoing process.
It's an ongoing process. Yeah. We are very lucky and fortunate to have friends like you among our society and helping with the evolution of the spine society here. So,
well, I appreciate you saying that, Rodrigo. But also, I want to say you guys have been instrumental for me in my thinking as well, and it would be untrue if I said our interactions have not led to an enrichment in my thinking and career. I mean, absolutely, the talks and even our side discussions at dinner, every single interaction we have together, because everybody that I've interacted with, all your colleagues from the Brazilian Spine Society, are incredibly thoughtful and very inquisitive. And every time I hear a question, every time I hear a thought or an idea, it starts to make me think too, and starts to make me evolve. So I appreciate the collaboration and the time, and of course the opportunity to be here.
The reciprocates so much true. So it's so true. Yeah. Thank you very much. So curiosity, watching other people doing surgery. What else? What would be the topics to make
I think
a good spine surgeon?
I think I tell my fellows this all the time. Passion, yeah. And a part of passion is the attention to detail, right? Oh, so I always talk about attention to detail, because there are so many little things, especially in spinal deformity surgery, that could go wrong. And in some ways, we we as a society say, well, oh, that person is obsessive compulsive. But I got to say, if you're going to pick a spinal deformity surgeon, you want them to be obsessive compulsive, right? Because, because
there's so many variables that you have to manage at the same time. Yeah.
Absolutely right. And I think if you're not aware of it, then the mind doesn't know. The eye doesn't see what the mind doesn't know. And you have to try to know everything that could possibly happen. Everything is potentially a landmine, and you're avoiding all of it to try to get to the other side. And that's spinal deformity surgery.
As human beings, we're very bad in predicting risks. So
yes, exactly.
It's hard to control many different factors at the same time.
Exactly. Yeah.
Absolutely. You want to give a final message to young surgeons? Please feel free to talk whatever you think it will be useful for them.
Yeah, so I would say first, it's an honor to be here at the Brazilian Spine Society meeting, the 19th annual, and to have great friendships with Carlos Romero and Rodrigo Amaral, and as well as a lot of other Brazilian spine surgeons who I've become very close with in the last decade. I think if I was going to give one piece of advice to young and aspiring spine surgeons, it would be to have an open mind that allows allows the avenue and the opportunity for collaborations, learning, and that's going to be a branch that will open up into other opportunities, research, improvement in surgical skills, collaboration within your own hospital system to improve the overall delivery of care for your patients, the way you are with your patients. I think the foundation is within that openness and collaboration. So with that, I leave you with that mindset.
Thank you very much. Amazing. Thank you.
Thank you.